Welcome viewers of Dimapur News. We have an update. As we all know, India is suffering with second wave of COVID pandemic. Into this, another disease known as Mucormycosis has been declared as epidemic in many states of India. Union Health Ministry on May 20 informed the states of India to declare Mucormycosis, simply called as black fungus, a reported disease under the Epidemic Disease Act 1897. Ministry of Health and Family Welfare and Indian Council of Medical Research said every government and private healthcare facilities, medical colleges and department to work onto the instructed guidelines for screening, diagnosis, management of mucormycosis. States are asked to report every single confirmed or doubtful cases of building fungus in the body observed under recovery or fully recovered coronavirus patient to the Health Ministry. Several cases of black fungus are being reported in many areas of the nation. On 19 May, All India Institute of Medical Sciences (AIIMS) updated with referred guidelines for the advanced detection and prevention of mucormycosis in the hospital's COVID ward. The fungus are around us, but they need a very specific environment in a person's body to cause infection, says Dr. Arpana Mahajan to FIT. It's most common in the nose, sinuses, eyes and brain, she said. Once it has spread to the brain, treatment can be very difficult. Now let us tell you which ones are at high risk. Medical expert says cases of black fungus have been reported in COVID patients who have been given steroids to treat symptoms, as well as in people with diabetes and cancer. According to the AIIMS guidelines, the following groups or people are exposed to a high risk: patient with uncontrolled diabetes, diabetic ketoacidosis and diabetics on steroids, or patients on immunosuppressions or cancer treatment, and patient with chronic disease, patient on high steroid doses or prolonged steroid doses, and nasal teeth that are necessary under the mask or above. The symptoms which are to be observed: abnormally black discharge or a crusty nose or nosebleed, headache, eye pain, swelling around the eyes, double vision, red eyes, loss of vision, difficulty in closing eyes, inability to open eyes, tingling or numbness on the face, difficulty on chewing or opening the mouth. In this case, patient should immediately consult an ENT specialist or ophthalmologist for treatment. 1,500 cases and 90 deaths due to black fungus have been reported in Maharashtra. In the national capital, the government announced on Thursday that a black fungus special treatment center would be set up in Tree Hospital in Delhi after AIIMS announced it will monitor more than 20 cases of fungal disease every day. States including Rajasthan and Telangana have classified fungal infection as epidemics. In another report, a COVID-19 patient who earlier recovered died from a black fungus infection. The first such case was reported on Wednesday in private hospital in Guwahati. The 27-year-old man was admitted to hospital on May 16 in a view of critical condition with all the symptoms of black fungus infection, the hospital authorities said in a statement. The man was from Nagaon district and is said to have diabetes and tested positive for COVID-19 on May 6. He was later treated at a COVID care center in the district. He then tested for rapid negative antigen on May 12 and left the center. Since May 15, after he went home, had vision problems in both eyes and other complications, the statement said. The patient was rushed to the hospital's emergency room on May 16 in a very critical condition and taken to the intensive care unit. Despite the best efforts of the clinical team, the patient died at 6 am, the statement added. News Desk Report, Dimapur News.